Hi, everyone. I'm Dean Karlan, and I'm here with Annie Duflo.
Hi, everyone. Good morning.
So I'm a professor of economics at Yale University and president and founder of Innovations for Poverty Action. Innovations for Poverty Action is a nonprofit that is dedicated to discovering and promoting things that work around the world to solve poverty problems.
Hi, I'm Annie Duflo. I'm the executive director of Innovations for Poverty Action, and I've been with the organization for more than 5 years now.
So we are doing a webinar, as you all know, to help deliver our message and help donors out there who are thinking about how can I maximize my impact around the holiday giving season. And we're going to be doing two parts to this. First, we're going to have a presentation that will go through some thinking about how to think about charitable giving. And then we just want to open this up to Q&A. And so to do Q&A, when we get to that phase, you'll just unmute, please, and then you can pipe up and ask questions. And there's also a way of chatting in. You can type into the webinar thing and type out a question, and we'll see it then. So, I'm an economist, and so I often start thinking about problems by asking, why are we thinking about this as a problem? Why didn't markets work and make this all happen? Why didn't people come together and just make the right transaction happen to solve a social problem? When we think about poverty around the world, we're struck by the fact that there's 2.4 billion people that still live in poverty. And a lot of people, like everyone here, hopefully listening to this, that are also thinking, I have some resources and I'd like to do something about it. And the basic market problem here is one of information. How do you know what to give to? How do you know what's really working and what's not? I have limited funds. I can only do so much. So where do I put those resources? And that's the basic problem that we're tackling. But I want to start off with a little bit more of a philosophical discussion. And I want to think about, how do we think about charitable giving? What do we think of, what is the right comparison in the rest of our life to our charity work? So think about a choice between food, which I'm going to talk through first, and then I'm going to talk about investments. And I think when we think about charitable giving in these two contexts, it tells us a lot about why we give. Suppose for a moment that you have a choice, pizza, sandwich, or pasta, just like this slide shows. And suppose that you want pizza. You say, pizza, I like pizza more than sandwiches, and I like sandwiches more than pasta, and so that's what I want. Does that mean that every single day of your life you want to choose pizza over sandwich over pasta? Probably not. You would probably get sick and tired of the pizza after a while, and you'd want a little bit of diversity. The other day I was at breakfast with some friends, and we were talking about what they do. I was talking with one person who I just met, and so it was a very open conversation about what she does for her philanthropy. And I was really struck by her answer, which was, well, there's many things out there. They're all very important, and so I give a little to each. And I asked her, well, do you think it would be possible to rank them and say, well, the work I'm doing for cause A is, the thing I'm supporting for cause A is better than B, is better than C. And she said, yeah, probably. So I said, so suppose you're giving away $10,000. Rather than go a third, why aren't you going all in on the one you think is most effective? And what was clear was that there was a big reluctance to wanting to do that. And it's not, there's an argument for a big donor to say, well, maybe you're actually changing the relative ranking of these. But for most donors, that's not the case. You're not giving so much to cause A that all of a sudden that you're flipping the order and money to cause B is actually more effective. And so the question is, why diversify? Why not go all in on the one that is most effective? So now let's think about this as that. So then I think part of the answer here is that we often think about our charitable giving in the same way that we think about things that we consume, and it tells us something about our giving is not strictly out of a desire to maximize impact. It's also about the emotional satisfaction we get from having given to different things. But now think about it as a bank account. Suppose you had a choice of 3 bank accounts. Bank account 1, 4%, 2, 3%, and bank account 3 gives you a 2% return. Everything else is exactly the same in this scenario. Same safety. For simplicity, let's even say it's the same bank, and they just give you a choice of 3 accounts. Say, which return would you prefer? Would you find yourself getting bored of the 4% return after a while and saying, I've been doing 4% for too long, I'm going to try 3% now because I'm, kind of tired of that 4%? No, obviously you would not. 4% is better than 3 is better than 2. So if we were driven strictly by altruism, in our giving. We would do the same math and we would put it all into 4%. Again, with the caveat that we're not so rich that we're actually changing the returns on these different ideas. So there's an important lesson here, though, for our way of thinking in terms of advice we give. When someone comes to us and says, what should I give to? We realize that a lot of giving is being done out of a consumption motivation, of motivation for emotional satisfaction, emotional attachment to diverse ideas, and wanting to participate in various causes. And it's not our goal to try to switch people to a different cause, to say, well, you came to us asking about health, and we're going to switch you to an education intervention. Rather, what we want to do is more like the following. Suppose there is pizza, and now you're just choosing across pizzas. Now, different people might rank these pizzas differently. Let's suppose that these three look roughly the same to you. But that one of those pizzas, if you bit it, you would discover that pizza on the left is much better than the one in the middle, which is better than the one on the right. So our goal is to take the person who says, I want pizza, and to help them figure out which pizza is the best. And now, given the way these look, it's very hard, and that's the same problem we face in the charitable fundraising literature, in the charitable fundraising space, which is that there's many charities, and they look very similar. And it's very hard to figure out from the brochures which one actually is most effective. And so with that, more abstract, because I'm the professor so I can be nice and abstract and wonky, I'm going to now pass the baton over to Annie Duflo, who's going to tell you a little bit more hands-on what this actually translates to and give you some examples from our work about how we're helping consumers choose which of these pizzas is actually the better pizza.
So now let's decide that you decided to invest into education because that's what you care about. So there are several possible ways that programs can improve attendance in school. For example, some programs provide financial incentives like merit-based scholarships or conditional cash transfers. Other programs involve improving the health of children so that they feel better to go to school. Other programs involve providing information to parents about the benefits of going to school. All these programs sound good. So what this graph does, which was put together by our partner, the Poverty Action Lab at MIT, is that it compares the cost effectiveness, or in other words, the returns on investment for all these programs that are listed on this slide. And as you can see, there is a big difference. With the program on the far left, with $100, you can get 40 kids to attend school for 1 more year. Now, with the program on the right, you can only get 1 kid to attend school for 1 more year. There is a big difference. The point is that it's not necessarily obvious which program corresponds to which column. So I'm not going to spend too much time on the answer. This is actually the answer on this graph. But there are really two key takeaways from this. So even so, if this graph is not to be used as a Bible, but rather as a tool, what this means is that there can be a big difference in terms of the impact that you get for your dollar when you invest in an organization and in a program. And the second key takeaway is that it's not necessarily obvious which programs will generate the higher returns on investment if you don't have information about the impact and the cost of these programs. So even if you will never have full information, it's really worth thinking about it when you're about to invest. Now, that doesn't mean that every organization that you're going to support should have conducted rigorous impact evaluations of their work. It's not possible. But what this means is that it's really important that organizations are thinking carefully about the impact that they're producing, that they use existing information as much as possible. And it's also important that you think about it when making those investments. So now, hopefully you're convinced that you're going to invest, and you are probably already convinced since you're listening to this. There are two kinds of investments, broadly speaking. There are short-term investments, and there are long-term investments, and both are equally important and valuable. So with short-term investments, you invest in programs that are going to benefit kids or people today and in the next few years. With long-term investments, you invest in creating the information, the infrastructure, and the partnerships that are needed for future programs to generate the higher returns on investment possible. So if you want to make short-term investments, as mentioned earlier, what's important is to think about the impact that these programs are producing, the returns on investment. If you're going to make long-term investments, well, this is all IPA is about. As you know, we discover and promote effective solutions to global poverty problems by creating the evidence and then by mobilizing other organizations, non-profits, governments, or funders to use and apply this evidence that we have generated. So with that, just summarizing our tips for the end of the year. The first advice is really make an investment, whether it's short or long term. As I said earlier, both are equally valuable and important. So if you're going to make short-term investments, think about evidence-based interventions. So there are organizations that are really dedicated to design programs based on evidence. So for example, our partners, Evidence Action, Pratham, but there are many others as well. You can also look at the Proven Impact Fund link on our website, which lists a number of programs that have been demonstrated through rigorous research studies. If you're going to make long-term investments, there are organizations like IPA or partners that create the information and the infrastructure that's needed for future programs to be as effective as possible. Now, going back to the short-term investments, you may be thinking, okay, that all sounds good, but where do I find this information? The problem is that I don't have this information. So as much as possible, free ride. There are other organizations that have taken the time to get some information. So use those. So GiveWell, for example, other foundations have done a lot of research, like the Hewlett Foundation or the Gates Foundation. So maybe you can look at organizations and programs that these organizations are investing in and follow their lead. So that's it. Now we're looking forward to your questions and to engaging with you. So just to remind you how to ask questions, I think you just speak up.
I have a question. So based on all of this, so where should I actually be giving money? I mean, I feel like we've gone through a list of things, but where do we give?
So I think the first decision, as Dean said earlier, is what kind of things you want to invest in. Do you want to invest in education, in health? That's more of probably an emotional decision, and you may have your own reasons for making that decision, and that's fine. So if you already have made this decision for yourself, then as mentioned earlier, I think one advice is to look at organizations like GiveWell or foundations that have done the research, that have done due diligence, and that have looked at not only which programs work, but they also have looked at which organizations seem to implement those programs well, because that's obviously also another important component that we have talked less about. Dean may have additional advice.
So I think the other thing to think about is really small groups that are doing something truly innovative. And now that's an easy thing to say. It's much harder to actually implement and say how is a donor supposed to figure that out. But there are things out there that are just that, very small, innovative programs that are actually too early for really rigorous evidence, but that are clearly the type of place that are trying to figure out how a solution may work on the ground and are open to providing evidence so that it doesn't just become one tiny little thing that's tried and nobody ever hears from again. So, groups that are doing that type of innovation work, I think, can be very, very useful and important. I see.
There's a question. What do you think about Give Directly?
So I think there's two things I really like about Give Directly, and one, recognition. I wouldn't say it's a criticism as much as a recognition that it's not what we should. That there are other things out there that might be more promising. The two things I like about it, one is it's incredibly efficient, right? It's very, you want to think about just a direct transfer of wealth to the extent that we are driven strictly by altruism, and we say, there's many problems out there. I don't know exactly what's working, what's not, but I know redistribution of wealth is something I want to do. There's people out there that need the money more than I do, and this is really efficient for getting money from someone who says, I just want my next dollar to be spent by somebody else rather than me. and it's getting it to someone who's truly poor. And that's where it's really nice in how efficient it is. The second thing I really like about what they're doing is they're doing careful documentation of their evidence, actually with a randomized trial, but this is, I would say this even if it was not by IPA, but it is IPA that is conducting the randomized trial that has found nice positive impacts on a multitude of areas, which is exactly what you'd expect when you give somebody cash. You don't expect the money to go to all one thing. You're seeing improved housing, improved investments, things of this nature. The one concern I would say is that there are many problems out there that are deeper than mere redistribution of wealth. There's information problems like I referred to in the very beginning. If the problem is for a household is that they don't have information about the health care they need, giving them money is not going to lead to the improvement in health care. You need to have them better informed. A study we did in Ghana at IPA's, one of IPA's larger offices in Ghana, we tested out for farmers a very simple trade-off. For some farmers, we gave them cash. It was very much like give directly, just here you go, here's cash. And for other farmers, we gave them rainfall insurance. So that we gave them no cash, but we gave them rainfall insurance, which helped take away some of the risks they face from bad rainfall. And we found that the rainfall insurance led to a much bigger impact on investment than giving them cash. So this is just a striking point that says that while, yes, giving cash can lead to a lot of good things, there are other problems out there that are deeper than one can solve by mere redistribution of wealth. And that's one of the things that we're tackling. And just like I opened up in the very beginning, we're not of the ilk that all things should go to one solution by any means. There's a certain simplicity and elegance to give directly and an efficiency to it, and so we're very much encouraging people who ask us to go ahead and support that. But we also think there's a lot of other things out there where you can probably get more bang for your buck, and these need to be figured out and tested like we're doing. There's some questions.
A couple questions. Okay. One says, another possible metaphor for this is a portfolio investment. If you aren't 100% sure an organization is well run, issues of evidence aside, wouldn't that be an argument for diversifying your giving?
I think that yes, from an emotional perspective, in that if you want to feel that at least something worked in a sense, but it's not clear why we should be behaving as risk-averse beings when we're thinking about this from a strictly maximizing good perspective. If we actually have one that does have evidence to say it's better than another, then that's diversifying at a very clear expense. Having said that, it's the nature of the beast. I mean, I will be the first to admit that I give to multiple things as well. I do give, the majority of giving that I've done in my life has been to IPA, but it is the case that I do give to other things too, because I'm an emotional beast just like everybody else.
So, another question, how should I think about the impact of organizations like Heifer International?
So Heifer International is an interesting group that is, for those not familiar, basically providing livestock. Maybe they do more than that, to be clear. I don't know the full slate of everything they do, but what they're most famous for is working in communities and doing direct transfers. And they give the donor the really strong salience of feeling like I just gave a goat. And you can look at their catalog and actually have different prices for different animals. So we're doing a series of studies, 7 around the world, that evaluate a program that is like Heifer on steroids, I think is the right explanation for it. So basically what it does is it says the problem with being in the ultra-poor is not just one thing. You cannot solve it just by transferring the goats, but you also need to provide health care. You provide some food along the way so that they don't have too many incentives to sell the goat immediately. And then they have the caloric intake necessary to take care of the goat, or whatever it may be. It may not be a goat, it may be something else. A savings account is also often provided, and a lot of training and monitoring to help make sure that that whatever the asset is that is transferred generates income in the long run. So we've done 7 of these studies, and we're finding really strikingly positive outcomes, not from every single site, but from most. And so this has been a very nice endorsement of this approach to dealing with the ultra-poor, which might actually provide interesting motivation for a group like Heifer to say, okay, let's find out, is all that other stuff necessary? Because what we're doing is much cheaper, but also doesn't have those other things. And so it would be very interesting to see Heifer do a randomized trial to find out what is the impact of what they're doing. My understanding from what we've researched And I want to be clear, it's not that I've talked to them directly, so I don't want to be quoted as saying that they've never done one, but I'm not aware of a randomized trial that they've done or a study done by somebody else of exactly the heifer model. So it'd be very interesting to compare that model to the model that has been showing to be successful, which is this model that we refer to as the graduation model, in the sense that it's helping people graduate out of ultra poverty with a much more holistic approach, providing a package of services across the spectrum of needs.
Did you have any specific organizations in mind that are small and innovative but are maybe not in the public eye yet?
So ironically, with one of those, someone asked it earlier, I put Give Directly in that bucket, although they've obviously been getting a lot into the public eye, but it is a very interesting and innovative approach for doing something very, very simple and straightforward. I think there's other groups that are doing work, for instance, on energy efficiency that I think might have some, very interesting gadget type approaches that, in theory, the promise is quite clear in terms of reduction of both a carbon footprint and also reduction of indoor pollution and reduction of fuel costs. But now seeing these actually work is a very different beast, and there's a lot more work that I think needs to go into the tinkering phase to figure out how to get this going. So I would put a lot of things in that environmental category, into that category. There's a lot of things, too, in just the general high-tech world where we're seeing high-tech solutions to problems of poverty that fit into this description, that are in dire need of more money in the tinkering phase. And then the next phase from there will be, hopefully, the more quantitative evidence that you can get from a rigorous study.
I think with small groups that are doing innovative things for which we don't have evidence yet, what's important is that they carefully think about the impact that they think they will have, and why do they think they're going to have such an impact. So they may not yet have an impact evaluation, but they should have carefully thought about the mechanism of creating that impact, and that I think is really important as well.
There are also a couple groups that I think are doing things that are offshoots of the main organization that also satisfy that kind of statement. So, for instance, Kiva Labs, something which I believe is going to be launched soon, is my understanding, and it's an offshoot of Kiva. Kiva itself is a model doing more or less plain vanilla microcredit, which the impact data that have come out from this show that it has mildly beneficial outcomes, but not something that is the type of thing one wants to put donor money into. But Kiva Labs is specifically responding to that by saying, well, let's innovate. Let's try new approaches to lending that might be more creative and have more positive impacts, and let's find out whether these are more successful or not. And so I very much admire what they're trying there, and would put them into that category of that tinkering innovation phase. Although this, like I said, is an offshoot to a larger entity. Grameen Technology Center is another example of that. A Grameen Foundation that is trying some innovative add-ons to what they're doing, which is kind of to the side of what the main organization does, but that is very, very interesting and potentially transformational work.
I've been supporting a local battered women's shelter, but obviously there's no evaluation for this. How do I decide between supporting this local thing versus something internationally?
You want to go with it? So this is always this a little bit goes back to the question earlier about asking oneself, why is one giving in the first place? To the extent that it is strictly out of altruism, then think about the trade-offs, and ask yourself, okay, in this local entity, which is working with battered women, for my $1,000, this will provide support for, and I don't know what the numbers would be, but let's say 10 women for a certain service. And then look in a developing country and ask, okay, $1,000 will immunize 100 children from the following suite of diseases, which will on average save one life. And then ask yourself what that trade-off is worth. And that's really the question that one should always be facing. That's the purely analytical, altruistic answer. Of course, the more human answer is to say, well, there's a part of us which wants to feel attached to many different good causes, and we don't always want to trade them off. We want to feel a part of each one. And in that situation, that's where I would say you need to think about, well, okay, of the various options I have locally to give, which one is being most effective. It's not I have nothing to say about the battered women's shelters, since obviously I don't know, this is not a space we dive into. And then what we would encourage, though, is of course to think more globally as well, and not make it not to strictly give locally, because I do think when one thinks strictly as an altruist, it does tend to direct people to where the greatest needs are, and the greatest needs do tend to be overseas.
One thing to add, and that's not exactly answering your question, but it's somewhat related, is often people also want to give their time, and I think that relates to the emotional part of charity. One wants to support, but also to feel involved. And so sometimes you have to think not just where you put in your money, but also where you put in your time, if you do have time to volunteer. And that's where the global versus domestic trade-off can be interesting. It makes more sense to give your time to organizations that are close to you, because you're there and you can actually participate. Whereas it's very difficult for someone in the US to effectively, participate in what's going on in a country that you haven't visited. So it makes more sense to invest your time domestically and your money globally.
What would money go to if I gave to IPA?
So in the last 10 years of our existence, we've been very focused on increasing the body of evidence about what works and what doesn't. It's been the focus of our work, and that was really answering a gap in the world, which is that there wasn't enough evidence. And while there is still an important need for evidence, there's lots of open questions, now an important question is, now that we have created evidence about what works and what doesn't, we have some answers. Let's make sure that these answers actually get used and translate into large-scale evidence-based programs that benefit millions of poor. And that's one aspect of our work in which we're going to increasingly focus in the next 5 years. That aspect of our work has not been traditionally funded by research grants that are mostly funding our work so far. So your money would go into our efforts to mobilize decision makers, like nonprofits, governments, or funders, to use and apply this evidence. But we're happy to give you more details about how exactly this would work if you're interested.
So as a very simple example, one thing that we've learned a long time ago is to influence policy in a country, you need people on the ground meeting with the government, meeting with other NGOs, helping to see what are the problems they're facing, and to then map their problem to the data and the evidence that are out there from other places. And it's not always as easy as just saying, here, take this little paper and go do this. And that takes time, and that takes labor, and it takes high-quality labor. And so one of the things that we do is we hire policy people to go and do that type of work, working with the local Ministry of Education, helping them learn from these results so that they can adapt their programs to use the best evidence out there.
And maybe to give you a very specific example, very briefly, we've been working with the Ministry of Education in Ghana to help them design and implement a program that's based on evidence that was created in India with Pratham. So the next step for us is now to help the government expand this program that has been demonstrated to work in Ghana as well. And the goal is also for us to leverage this relationship that we have created to help the Ghanaian government to implement other evidence-based educational programs.
Between investing in health or education or microfinance or maybe something else, what would you suggest we give to?
This really goes back to what Dean was talking about at the beginning of the webinar. We are not really able to give you an answer on this, and that's not really what IPA's work is about. What we're about is really within education. If the goal is to improve learning levels in school, what kind of interventions will work best and what kind of interventions are most cost-effective. Now, between health, education, microfinance, we think that these are all important areas, and what's more important may vary depending on the context. And well, going back to what Dean was saying, maybe that's more of a personal decision that you have to make. Maybe you feel personally more related to one of these areas. Great. Well, Thank you very much, everyone, for attending this webinar. As I said earlier, we're very happy to engage at any time. So if you have any more questions or would like to talk more to us about what we have discovered in the last 10 years of creating evidence, if you'd like to talk to us more about IPA's work, we'd love to do that. So reach out.
Thank you very much, everybody.